So, what brings you into the office
Well, I have some.
besides your wife?
I have some numbness on my skin on my right hand. My right hand.
And this numbness started when?
It started a long time ago. Probably I'm talking about 20 years ago,
Okay.
or 25 years ago or so.
Okay.
The numbness, it didn't start right away, but it came from time to time. But the pain
Do you
is,
recall the incident though?
yes.
What were you doing?
I was doing some jackhammering
Okay.
hand tool, and we work all day with the
You're breaking up
you know,
concrete.
on the hot weather. Yes, and we done with the day, and I got into my truck to go back to the office when I fall asleep in the front of the window with the window open. And by the time I wake up, I had this pain on my shoulder, on the back side.
Pain on the backside of the right shoulder.
Pain on the back side of the right shoulder,
Okay.
almost to the spine. Not sure exactly where, but that's where it began. And then I have, after that, I started to get numb slowly during the years, to the point where right now it went down all the way down to my fingers, and I feel like
All the fingers?
I most of it is 3 fingers, but the pressure.
These 3 fingers or these 3?
No, these 3. Well, no, the numbness is in the whole thing.
The whole hand.
Yeah.
The whole arm.
Yeah.
So let me just rewind for just a second. So after you were jackhammering, long day, got in the truck, you felt it was cold, fell asleep, you woke up, you started with the pain in the back of the right shoulder.
Mm-hmm.
Over the years, it went from that to numbness.
Yes.
And the numbness has started here and it traveled all the way down into the whole arm.
Yes.
Okay. And you're feeling the numbness now.
Yes.
Yes. Okay. Continue, please.
The numbness is like on the surface, almost on the skin only.
Okay.
If I get it injured and it penetrates the skin, I feel it if it's deep cut.
Okay.
If
This is good
if
information.
if it's not deep enough to touch the nerve or the muscle or the bone, if it's like almost like this, I don't feel it.
Okay. Now let's go. Let's ask something else. You can feel the pressure.
Yes.
The pressure of my
Yes.
finger.
Yes.
Put your hand down. But if I go like this, do you feel this?
I can feel the movement, but I don't feel not even your temperature.
So you don't feel hot or cold on
No.
that arm.
No.
It can be cold outside. You'll feel your left arm is cold, but not your right.
Correct.
It can be hot outside. You will feel it hot on your left side, not
But
your
not
right.
on this one.
I got it. Okay. Now, we're today. The whole thing is numb. What makes it feel better? What makes it worse?
When I put something warm on this side right here, all the way to here, in this section, it makes it feel better.
On the back
Right.
side of the arm.
Yes.
Okay.
Or when the section where the pain started, it gets massaged.
Okay.
It makes it feel better.
So if you get massaged in the back of your neck and that
in
shoulder,
the lower part.
lower part, it
Yes.
feels better.
Yes.
And it lasts how long?
It could last. It could be 3-4 hours, 5 hours.
Okay. All right. So you're giving us good information.
When it's cold, it hurts. It hurts my whole arm. When something like ice, or I lift my arm outside
Yes.
and it gets cold under the rest of my body. When I wake up, my whole arm is in pain.
Have you seen anyone for this?
At the beginning of the injury, I tried to explain to the doctors, yes, but they say I was crazy.
Are you
because
crazy?
no,
Is
sir.
he crazy?
Not usually.
Okay.
But they say no.
I'm just asking. I mean, the doctor's asked you, so I
Yeah.
gotta ask the same thing.
Yes, they
Has,
told
has
me.
he been evaluated? Okay, I'm
They
joking,
tell me.
I'm joking.
They tell me I was crazy. I said, why you think I'm crazy? He says, because there's nothing wrong with your arm. There's nothing wrong with your shoulder. You don't have a cut. You don't have anything like that. And that was before my whole arm went numb. That
Got
was
it.
at the beginning that I had the pain on the top side.
Okay.
One other thing that is happening is that when all this pain gets too much, it was a point where I dropped the things from so much pressure that I have here. I could not hold small things like if I
Because
grab,
you don't have the power or you don't feel it?
because I don't have the power.
Okay, so you don't
So
feel all of this,
No.
and then you have no power in the hand.
Right,
3 fingers, hold all of them.
whole hand.
It's hard to close and grip.
Yes.
Okay.
Right now it feels like I try. It's sold up. This whole thing. This arm feels normal.
Okay.
I don't feel nothing.
And you've never had that, whatever sensations and feelings you're experiencing on your right arm, have you ever had it on your left,
Never.
even temporarily?
Never.
No. Okay.
No.
All right. And that's the number one reason why you're here.
Yes.
Okay. Anything else I need to know about this condition before we move on? Any whiplash injuries? Any car accidents?
I had a
Any
car injury like I think in 2014, and it was a big time whiplash. It was a drunk driver hit me at the rear of my vehicle.
Okay.
He was like 50 miles per hour, but I was stopped on traffic completely,
Okay.
and that threw off something on my lower back, where I went to the doctor for 3-4 months or something like that, and after that my
Doctor, 3-4 months for what?
for therapy
Okay.
for my lower back.
Physical therapy?
Physical
Did you
therapy.
get any adjustments?
Yes, they were trying to do adjustments, but I got to the point where I told them to stop because it was getting worse. And then after that, my leg started going numb from my hip all the way down to almost my knee. First, it was with a tingling, and then it went to a numb point.
The same numbness you have on the right arm you got on your left thigh?
No, it was different. This one feels deep, the whole thing.
Got
The
it. So
whole
this is just the skin numb. This is the whole thing the whole leg feels
Right, the
numb.
whole,
But only to the knee, not past the knee.
not past any, all up to actually to right here.
Okay. And then from there, what was decided?
From there, after they did a lot of, they did shots.
Cortisone shots?
Cortisone shots
2,
on my
3,
back
4.
3 times.
Enough is enough.
And it went good for I think the first one it lasts like 30 days, but and then the pain came back. After that, it lasts like probably 2 weeks, and then came back again. And then the third one, it lasts like around, I don't know, 2 weeks, week and a half, the
Okay.
same. And they say it's nothing else we can do for you. And the pain started going so bad that I have to, when I was doing working or job walks, I have to stop and bend over all the way down to the floor, or touch my toes, or go against the wall and sit down all the way to the bottom to release the pressure, whatever that was doing. So after that, the only thing they said they can do it was a surgery to release the pressure from the bone that it was sliding down into the nerve.
So they did a laminectomy.
So yeah, something like
They
that.
cut some of the bone out.
They struck the bone now and they put a replacement in there actually,
And then they screwed it.
and then they screwed in the parts, the metal brackets or whatever they put in there
Okay.
to hold it together.
And how was your leg after the surgery?
The pain went away after, I don't know, I could say 3-4 months.
All of it?
It went away.
Good. Okay.
Just I don't know what it is. Once in a while, I don't know if it's my hip. My other doctor said that was my hip that it went off of a place. He says because the bracket that didn't move. But I feel that once in a while when it goes off, I can't walk. I have to lay down in bed I have to stay with face up in bed for, I don't know, 2-3 days with pain pills, and then it kind of moves around or relaxes the muscle.
You're talking about the bracket?
Yeah, on that section, yes.
Okay.
And it goes back into place, and then I get back up again like normal.
Okay. So right now you're getting it?
I don't have that right now at this moment.
So the low back is not an issue?
Not right now at this moment. No.
But has it been an issue?
Last
in the
time it
past
was
few months?
when we went to vacation 3 months ago.
2 months ago.
2 months ago, it was last time I got it. My knees sometimes it hurts right here, and I feel almost like if they are swollen. And
Both knees equally, one side more than the other?
This one more than
Right
this
side.
one.
Okay.
I do play golf. I twist around. I do this and that.
So you're still playing?
That's probably, I don't know if that contributes to it, but sometimes I'm not, I don't play, and I'm just sitting on the truck, and I get off the truck and start walking, and then I feel this pain here that I limp
Okay.
from time to time.
And then what do you do to make it feel better?
I can do nothing. I just,
Ice?
no, I
Enzymes,
haven't.
pain pills, something?
No, I don't. I tried for this. I don't feel it too
Rest?
painful
Okay.
for me to take pills. I try not to take pills
Okay.
when my back goes bad, and then I take pills because that's horrible.
Got it.
But other than that, little pains and like other than stuff, no, I don't take pills. So I wait, and I try to move it around, just like that. So
How are the ankles?
the ankles are good. I don't have no pain in those. No.
How is your sleep?
Awful. I don't sleep too much. I
Why?
wake up.
Pain or?
Well, this thing wakes me up a lot.
Okay.
When I forget, and then if I have the fan blowing, these get some pain really bad.
But you're saying you went, okay, you've had this for a while now.
Yes.
And they didn't find anything.
Right.
But it's still bothering you.
Yes.
And it's bothering you to where it's waking you up at night.
Yes.
Okay, that's a little important because then
Yeah.
you're not getting your proper sleep, right?
Right.
And you're not healing and you're waking up. Is he cranky in the morning?
Little.
A little bit. But no, I'm asking. That's right.
Try to be as nice as I can, but
But when you don't sleep, you
Yeah.
get cranky.
yeah, and I can feel through in the day because I didn't sleep enough. I can feel my eyes. Well,
And then,
probably that's another story.
what's that?
Not driving and not, when you don't sleep enough, you go driving. It's like,
Yeah, you don't want to do that.
yeah.
Okay. There's one thing I do want to address with numbness, okay? And this is really important about the numbness. If this is a true numbness case, okay? True numbness means you have no feeling, which is what you're telling me. In this work, typically, let's say someone comes in, I have shooting pain down the arm, right? Shooting pain down the arm, we're on the right vertebrae, that's causing pressure on the nerve, we get that released, the pain starts to get less. With true numbness, it's gonna hurt before it gets better. What do I mean by that? You may get some sharp or some electrical signals you may
Mhm.
feel. It's a good thing, it's not a bad thing, where it is numb. Okay? It's important, it's very important. That's the one difference in this work that we're doing. If he's telling me here, like as an example, the shooting pain, I'm just repeating it. There's shooting pain going down my arm, we find the problem, we start to address it, the pain gets less. This whole hand, this whole arm is numb, we find the problem, what may happen, he may get some electrical signals.
Start walking down.
Oh, what's that?
They're gonna start walking down.
Exactly. Meaning we gotta turn it on.
Hmm.
Okay? Here, you're saying it was more of the deep numbness,
Right.
right? Same thing. If it's a true deep numbness, you may get some shooting pains before it gets better. If there's no change over a period of time in the numbness, and we don't get that shooting pain where it's numb, then we have to reevaluate what we're doing. Okay? We need to reevaluate what we're doing.
And then since he did have the back surgery and they did fuse the spine, is there any issues with having adjustments?
We have had historically a lot of post-surgical cases. The question is, I'm not adjusting the hardware, okay? We're gonna see where the pressure is. And we have many different ways. I have videos of me adjusting. There's a couple of videos of me out there adjusting post-surgical cases where the patient still has an issue, okay? But let's figure out what the problem is first. Once we figure out what the problem is, then we can decide how are we gonna correct this or remedy this. Sound good?
Okay.
Okay. Why don't you stand up and walk for me, please? First thing we wanna do is focus on the dimples. And let's watch the walk. We're focusing here. Go ahead and walk. Is this how you walk, sir?
Yes.
Walk how you normally walk.
That's how I walk normally.
He walks very guarded.
Depending on his mood, but yeah.
Okay. What's your mood like right now? Tell me.
I don't know what's the difference, but I feel good right now.
Okay.
That's how I
You
walk.
feel good, meaning what do you feel? You feel the symptoms, but no one's.
I don't feel anything on these sides right now.
Okay.
It only when they go out, when that goes out, I don't walk.
Okay.
I can't walk. I can't even attempt to move.
Okay. Straight line for me, sir.
I cannot even get out of bed or nothing.
Turn around, keep walking, please. Back and forth several times. So you see how he tilts right above where the scar is. You got a little bit of that waddle going on, a little jiggle side to side. Watch his feet. Now here's the interesting part. Let's watch his feet, what's happening. They both kind of go out, but he tilts and goes to that left side. Okay? Is that right, Don?
Yeah.
Are you on his right side typically when you guys walk, or his left side?
It depends on which side the street's on. Goes back and forth.
Interesting, okay. All right, keep walking. Now stop right there and just march in place. March in place. Knees up a little higher, please. So you can see now he's tilting to the right side. The right foot externally rotates a little bit more than the left. He's walking on the back outside of the right heel, and there's pronation of the left foot. Okay, keep walking, please. I'm just calling out things I see, okay, sir?
Yeah.
So he's got decent movement through that pelvis, but there is a little bit of that wiggle going on there, okay? Not so bad. It's more that he's doing this. Okay, this is your walk. So that's what we got to sort out. What I want to talk about here is just the overall appearance of the spine and what's happening. We have 24 bones, 23 discs in between, and then we have the foundation, which is the sacrum and the pelvis. When we look here, the first thing we need to evaluate, do we have a level base and foundation? Think of this as a 24-story building. If we don't have a level foundation or a stable base, nothing else holds. Does that make sense? Okay, so we can see something is off a little bit here. We'll go in more detail in a second and just general overview. Then it curves to the left, it comes back to the right. Yeah. Then it goes up, then it curves to the left again, curves back, and there's a hard kink here that we need to figure out. Okay, so let's zoom in a little bit here. And let's see what we're seeing here, okay? When we're looking at the pelvis, we can see that the femur heads are slightly off, okay? But we're going to measure and see, is it significant or not? As we go up the spine here, so this is where the brackets or the fusion was done in the spine. All right, let's take a look here. So they removed some bone and they just basically braced it. The issue with this is while they braced it, it gave you some symptomatic relief. It causes hypermobility a little bit above. And then this, you can see, there's a big wedge here on this side, and it kind of kinks on that left. Okay, as it goes up, then same thing here. It kinks to the left here. Let's talk about what's happening in the upper back, because this is part of your arm issue, sir. Okay? You can see from here, there's a hard shift here. And this is around T1, 2, 3, T4, even T5. Because look, T6 and 7 look similar to each other on top of each other. T6 kinks up hard on the right, T5 kinks up hard on the left. You see that? There's a disconnect there. And so from here, it's kinking to that right side the whole way. The question is this compressing any nerves that could contribute to this? That's what we're going to figure out today. Okay? Now, does that make sense, Don?
Mm-hmm.
Okay. Now, so we have a hard kink here, and then what's the body doing? Trying to stabilize, trying to come back to level. Trying to unlevel, exactly. So my suspicion is there's something going on here that's contributing to the neck. The nerves that control this arm are coming from here. Okay? And this we have to make sure is not compensating from here, and we need to make sure that the foundation is stable. Okay, sir? Let's look at your side profile. This is what I don't really like, and this is a problem. I hope I'm not right in this, because here's the issue. L5, they did a partial laminectomy, removed some of the bone, yeah, and then they screwed it in. This is the sacrum. So you had L5 fused to sacrum. These two here, and then an extra pin there from the front. Here's the issue that I'm having, okay, in terms of this. We are designed to have level discs, okay? This is an angled disc here. So if I'm going to correct this, I want to push this forward first and then screw it in. You see this space here is open, right? This space here is angled. And this is whitening. It's almost like there's a little bit of scar tissue forming in here. This is angled down. I don't know whether there's pressure there until we actually examine you. But if there is pressure at 5, there's nothing I can do for 5. Okay?
Because it's in between.
It's between those hardware.
Brackets.
I'm not adjusting brackets. But what I'm trying to explain is this should have been put forward and then screwed in. This has been screwed in the wrong position. Does that make sense?
Yeah.
But here's what I'm hoping. I am hoping that's not the cause of the issue. And what happens, and this is what I see historically, is when you're getting an MRI, you're lying down for it. The stuck segment doesn't move, the mobile segment moves, making it look more than it is. Okay? What I'm seeing and what I'm suspecting here, it's down lower in the sacrum, S2, possibly even here at S3. That's what I'm hoping in terms of your symptom. If that is the case and we're adjusting down here, great. Okay? So I can work down low. I can't work here.
Correct.
I can't work here. When we go up, 4 is angled. 3, all these, you start to see the circles. That's because of the tilting, the compensations. Okay? You can see old compression. I mean, you're a physical guy. You're a physical guy. That's fine. Your discs are still intact here. Let's get to the neck. Your neck, see, now here's what's interesting. You're complaining of this here. These are beautiful. These discs are great. In terms of C2, 3, 4, 5, 6 are great discs. This may be a little bit swollen compared to the rest, maybe. But I don't see, because it's getting that reverse straightening and slight reversal starting. I'm not seeing that this is the cause here in here. There could be something up top, but I'm suspecting something is going on in the upper thoracic spine. Okay, that's my suspicion. We'll figure it out when we examine you. This is really what we need to figure out. Okay? All right? Now, the next component to this right shoulder is your scapula. When we look at your scapula, your right scapula is also out. But the question is this right shoulder coming from the kink? Because you can see it's kinking, right?
Mm-hmm.
With that kink, it's making one shoulder off compared to the other. And the idea is this area now compensating because of this? Let's go have a seat and take a look. Because this is the first time to hear that someone has numbness on the skin, but not deep, but then on the leg, the whole thing is deep.
Yeah, he's come in the house at least like 4 times I can remember, and he's bleeding. He was working on a cut or something, and he's like
He's bleeding and he didn't
Yeah.
feel it. Okay. Let's start at the base of the neck. You can watch here. You're not in it. You can watch up here. And when we start at the base, and the first thing is 15, 20 points up around C1, C2. There it is. $15 around T4, maybe T5. All right, let's continue. We got pressure at the atlas. We got pressure around T4, maybe T5. As we're running it down, we got pressure, another 15 around L2, L3. Thank God it wasn't 5. But then again, it wasn't 5. Let's go low. Sit up straight. There. S3, S4 down low. Go. Let's just tilt it this way down the spine. I'm going to talk about tilting the scope later, not right now. But we do tilt the scope in certain situations, and this is one of those situations. S3, S4, L2, T4, C1. Those are the 4 pressure readings I need. Okay, sir? Scoot forward. Let's check movement in the hips first and the pelvis. Feet together. Open and close the knees, please. Open, close. Open, close. Open, close. Right side only. So when he does the right, that whole left wants to move with it. Left side only. Right side is fine. Something is going on here on the left. Scoot back for me, please. So we have fixation left side. We have to rule out and make sure it's not just scar tissue from the hardware. Okay? Let's run our fingers down the spine. As we run the fingers, here's what I want you to see. Right there, it changes. Right there. And it goes right here. Pain?
Yeah.
More pain up top here
No.
or here?
Lower.
This one or
No,
this
right,
one?
Right there.
Head down, sir. 7. 1, 2, 3, 4. T4. T4, T1 through 4 is also major nerve supplies, sympathetic nerve supplies to the heart and lungs. So, question is this nerve issue? Is it circulation issue? As we run the fingers down the spine, let's continue. You can see it changes again. Orange peels right there, right there. Okay, more tender when I push here or here.
The lower one.
Okay. Now, let's count. 5, 4, 3, número 2. Now, part of L2 is nerve is what? Hip flexion. L2, L3 goes to the knee. L2, L3 is part of that thigh. Okay, sir?
Okay.
5, número 1.
Yeah.
Dos. Aquí. See?
Yeah.
Yes?
That hurts. Yeah.
S3. Tender here on the right?
Yes.
Tender on the left?
No. Pressure, but not tender.
Head down, please. Turn your head left. Turn your head right. Okay. Bend right. Bend left. We got a left atlas issue also. Pain?
Yeah.
Pain. I'm pushing harder on the right.
No.
Left atlas, T4, S3, L2. Stand up and walk it off, sir, and we'll get started. Okay, the sound is going to be this, sir. It's the board. Okay? It's not you. Nice and easy there.
Oh.
It's the board, okay?
Mm-hmm.
Nice and easy there. S3. One more. Gotcha.
Hip up.
Yeah, we got the sweat response too. Slide up a little bit. Turn your head to the left. Is that okay on your back?
Yeah.
Left hand here, sir. And we're going to do left atlas, ASL. Good. ASL. Home run, my friend. Let's look at his feet. Keep walking. This is after S3 and C1. Look straight ahead, please. Keep your head up when you walk. Good. 1, 2, 3, 4. T4. T4. Lift your chin up, please, sir. More. Nice and easy there. T4. Good. Easy. There. And that's the home run, sir. 1. Número 2. Poquito. It's a good fight. Oh, gotcha. Come off slowly. Hold my hand, please, sir. Breathe, breathe.
Oh, that one hurt.
Breathe. Walk it up. It's been there a while. Just walk.
I feel straight.
I know.
Isn't that great?
It's different.
Yeah.
It's different.
That one I felt, and that one I can feel. I can feel
His
really
dimples
straight.
are moving now better. Your dimples are, you're actually moving, your hips are moving right now. Okay? Just keep walking, sir. Several times. Taking some deep breaths. Anything shoot down your arm at all when I did that?
A little bit, I felt it. Not a lot, but it
Something.
yes.
On the right or the left
On the
arm?
right. I felt a little bit of release throwing like from the shoulder a little bit to behind the arm,
Okay.
but not too much. But I did feel something in there. I actually have felt a little bit of pressure release in here.
The pinky?
Yes.
Okay. Come back over here, have a seat. Let's re-scope you. Any pain when you're sitting right now?
No. I actually my arm all the way down to my hand and start feeling relief.
Say that one more time. Your
Um,
right arm?
My right arm all the way down to my two first fingers, my pinky and the second one, I start feeling pressure relief.
Very nice. 4 is clear, Atlas is clear, L2 is clear, S3 is a little bit there. No. So let's see if we have a breakdown here. We have heat. We don't have break. That's from the adjustment. Okay? Now, let's feel. You remember what it all felt like?
Yeah.
Come back slowly.
You're not screaming.
No, I don't feel the pain.
Bueno, let's do a little bit of your shoulder here, sir. Just to get that shoulder back in place. There, just a tiny one. That's it. Ears. Stand up and keep walking. 2 more times, and then we have 1 test to do.
I feel like I'm gonna hit that thing every time I walk.
It's part of the test, if people are aware. Okay, have a seat against the floor, against the door.
The door? All the way down?
All the way down, my friend. Have a seat. Sit on the floor. You okay there?
Yes.
Okay, so here's the test now. I'd like you to get up, and Don, you'll tell me how he looks when he gets up. Get up at your leisure, however you want to get up. What's different when you got up? Easier? Same?
Yeah, no, it's easier to get up.
Okay. Walk one last time, please, sir. His dimples are now moving up and down properly. They're not, you don't got the jiggle. I'm sorry I got rid of your jiggle. Squeeze my hand, squeeze hard. Good, squeeze hard. I'm not the jackhammer. Don't squeeze too, squeeze, squeeze. That's solid. Squeeze. I ain't messing with that. How are the fingers now?
I still have feel pressure on these ones.
These here?
Yeah,
Okay.
including these ones. But those, it release a lot.
Let me do the wrist a little bit, tiny bit. That's it. Go like that 5 times. Fast. Squeeze my hand. Squeeze. That's where we're gonna start. What's happening right now?
I can feel it feels like when it comes back from numbness.
So you're starting to get some feeling?
Yeah. All this right here.
Go like this. And down.
The hand don't know how to walk.
The ants are supposed to slide. Up, slide. Slide. One more time. Slide. Squeeze my hand. Your power is there. There's no power issue.
Yeah.
Raise your left leg. Hold my hands, please. Up high and down. Right leg up. Stand on that left leg. Keep that right leg up. Use my hands if necessary, if you need it. How is that left thigh when you do that?
Good.
Power.
Yes.
Okay. Right side now. Stand on your right leg. ¿Qué diferente?
It's
All
good.
good?
Yeah.
Okay. Welcome to the office, sir. I will see you in a couple of days.